Hello, Melissa Joy. Hi, hello, Poetic Pancake. Y'all may be able to hear me, I don't know. Or maybe you can't. Hi, Paige. Hi, Soccer Girl. 042291. Hello. Regina Jocoart? Hi. Oh no, your blender exploded? Oh God. So I have like, it's not a fear. That's not the right word. But I practice extreme caution in the kitchen because I'm really clumsy. And I get like, so when I'm cooking, I get like kind of in my head because I'm a perfectionist. So I like don't want to make any mistakes, which makes me more clumsy. And so I'm really afraid in the kitchen of like making a big mess. And so that usually ends up not working in my favor. But to have the blender explode, that would be a lot for me. So I'm glad you're here. Thank you. And I hope your mess wasn't too messy of a mess to clean up. Happy Monday. COVID-19 eating support has ended. We'll be here on Mondays for as long as I can keep making it a thing. I know that's not what they were doing, such a great job of being live every hour. Every hour. So that is a great resource that we're losing, but I hope that you can find some other options like this one. I've changed your life? Oh my gosh. Thank you. Thank you for saying that. That's why I'm here. Y'all. You put the plastic plate in the microwave. I'm really... like, I would be the person who ends up having things like explode or break in the kitchen because I just get so concerned about like the next step, right? That I'm not fully paying attention. But I've learned, I got this like thing, it's called a prep deck, and it has, the idea is to prep everything. And then when you're cooking, you just kind of throw in as you go. It's helped me in the kitchen to have things like cut up, prepped, ready to go. So when it's time to follow the actual recipe, I just have to throw in, mix, and go. Aw, thank you. From India? You're in India? I have it's not a secret, I have an obsession with India. So when I was a little girl, the movie A Little Princess was my favorite movie for a while as a young girl. And it took place sometimes in India. And since then I've had this obsession, this fascination with just like the color and the textiles and the culture. Indian food I like all the veggies, but I'm not a fan of the curry. I'll be honest. A lot of spice is not my favorite, but I want to go to India. I will go to India at some point in my life. It's like a bucket list trip for me to go. So, hi, hey. So if I came to India, what would be like, what should I do? Like, I would just want to, I don't know what I would want to do. I think like, I love like when I travel, like we love finding like markets, right? I love just seeing how people in any place just live and do their daily lives. Like I'm not a big touristy person at all. I don't really care about like museums and things like that. Maybe I should, but I don't. I want to just go where like the locals go and eat where they eat and shop where they shop. So, that's what I want to do. Hi. Aw, you're the best. You have a good day. Thank you. What inspires me most about my clients? That's such a good question. Paige, if you're still on, I'm eating a sandwich and chips. Very juvenile, but it's my fave. It's my fave Monday lunch. What inspires me most about my clients? So much. That, like, the resiliency of people, and to hear their stories, and then to, like, it inspires me just that they're so vulnerable and honest to come in and tell a stranger about their lives, things that really, cause them a lot of pain and upset and discomfort, that they're able to share that. So I think it's what that called is, I admire their courage. You're talking a lot about India and how big it is. Yes. So, I mean, clearly, right? Like, I couldn't see it all in a trip, but would try to. You love to eat everywhere you go? We map out, like, food places. Like, sometimes our trips are planned around eating, which is a reason to do recovery, right? So you can travel and eat the food and it not be like, it's part of the trip. It's part of the fun instead of obsessing and worrying about that. Aw. Miss Maddie Ferris, to grow with them. Yeah, I do learn a lot. I learn a lot from my clients, a lot. And what was fun about 2020, is I learned a lot, like, y'all know the shit we went through this past year, and to hear different, like, perspectives and opinions and beliefs about the things in the world helped me, I think, become a more compassionate, understanding person, because I know my clients are good people. They're amazing people, and they may have had, opinions or thoughts or ideas that differed from me, which helped me be like, but like, everybody's just doing the best that they can. At the end of the day, Lord Odin. Oh, and Finway's barking. That means there's either a cat at the front door or the mailman just stopped by. Ooh, Israel's on the list too. Definitely a place I would love to go. Guilt around eating. Well, I'm glad it helps you to see me eat, right? I think that's a big deal, is just normalizing eating. Like, it's not a thing. Truly, it's not a thing. It's just food. Doesn't matter. It does not matter what you eat, or it just, you have better things to do. You have more of a life to live than worrying about the food that you eat. Like, I want you to go live your life. So whatever you like, find those things to help you with that anxiety, find those things to help you with that guilt, because you've done nothing wrong for eating. Like, do you feel bad when you go pee or poop or breathe? Eating's the same exact thing. It's just human. We have to do it. It ain't a thing, but I know it's a thing. That's why we're here. Did anybody do anything this weekend that was fun? We're having spring weather here. Praise, praise, praise the powers that be. Praise Jesus. Praise God. It is so great to have nice weather, so we get to go out and do things. You love it when you poop, so I want you to, right? Eating is just like pooping. It just is a thing that we do as humans. So, right? You have nothing to feel bad about. The Instagram thread is really hilarious. I know TikTok, y'all can't see it. But there's a lot of conversating about pooping happening on the Instagram thread. And I'm here for it. I'm basically like a child. And anything about like poop or farting is hilarious to me. Yay, congratulations on your vaccine. That's great. It kind of throws you off, right, for a couple of days. That second one was hard for me. So, but rest, take care of yourself. Food, it's going to maybe be like weird if you don't feel well, but just know your body still needs, right, care and food. So eating foods that are going to help you feel good, right? Food can help us take care of ourselves. Hi. You went to Mississippi for a softball tournament. I know that, Paige. I hope you had fun. Here's a good question. What's the hardest thing to witness in the therapy room? When my clients are bullying themselves and shaming themselves and not giving themselves credit for who they are, like just getting so focused on a mistake or like a limiting belief, we get so like caught in the hamster wheel. It's so hard to watch because I'm like, you're amazing, you're a badass, you're a queen, you're royalty. Like, I wish that you would see what I see, and I only know you for like an hour a week. You know what I mean? Like, I don't really even know you in the way that people in your life know you. So like, that's what's hard. That's what's hard to witness, is clients not seeing their potential. You performed a speech at a UNICEF conference? That's amazing. That's baller. That's like, wow. Good for you. Passover. Yummy. Yes. Yummy Jewish mom foods. Brisket, matzo ball soup. You worked with some pharmacists this weekend? I have the coolest vibe ever. Thanks. Hi, I have a question here. What do I specialize in? So I'm a licensed professional counselor and I'm a certified eating disorder specialist. So I specialize in trauma, eating disorders, anxiety, depression. I love working with athletes, not necessarily eating disorder, but so like help people. My PhD is in health psychology, so really talking to people like holistic health and right mind, getting your mind right, your soul right, your emotions right, your all health right. So a lot of talking about holistic health in my work. Where do I practice? I practice in Texas, but if you're someone who's struggling with an eating disorder, we can offer you support through, we have the recovery-academy.com, where I teach you everything I know about treating eating disorders. It's an on-demand eating disorder recovery support community. So it's like, again, I teach you everything. I give you all my worksheets, all my like tips, tricks, and tools. I do all of that. And for a very like low, affordable cost. And there's opportunities to work with me and work with us as like a group and get the community support. So you're not doing it alone. I can support you from anywhere. No, you do not need a diagnosed eating disorder. I think that diagnosis is a privilege, and I'm going to maybe make some people mad with what I'm about to say, but I think that clinical psychology has kind of done a lot of harm to our field by pathologizing a lot of things, or as a result of labeling a lot of these things. A lot of people feel like they're not seen. They feel like they're struggling with stuff, but because it doesn't look clinical enough, right, it feels devalued. And so not everybody can get a diagnosis, but that doesn't mean that there aren't people who are struggling with an eating disorder, or who aren't struggling with even like disordered eating, or even just like food guilt and food anxiety, or body image guilt and body image anxiety. Like, is that a diagnosable eating disorder? No, but it certainly is something that causes you a lot of guilt and shame and anxiety and depression. So like, I think that you deserve to want to feel better. Like, if you have anxiety, guilt, and shame, and you don't like your body, you're allowed to want to change that. You know what I mean? Like, you're allowed to have the happy, I'm not trying to be like toxic positivity or all this bullshit that life is happy all the time, because it's certainly not. But if there's something that is causing you upset, you're allowed to not want to feel upset about that anymore. You're allowed to do like work and healing and information to try to feel on top of that, or more empowered by that thing in your life. The DSM is incredibly invalidating. This is why, again, I understand clinical psychology, because it's needed, right, to understand and like create like the science and that medical model, because mental illness is a medical condition. But it really does just, people in clinical positions are dealing with the worst symptomology, you know, like people who are having the intensest and extremist like symptoms and feelings and situations. And certainly people struggle. And I was talking to somebody earlier today about how they are able to look back over the last few weeks and realize how depressed they were, but during the time they were invalidating their depression and telling themselves they weren't depressed because it didn't meet that clinical definition, right? They were going to work, they were getting out of bed, they were doing things and living their life, but really had a lot of depression and a lot of anxiety, but because they didn't have, you know, these like clinical things happening, they felt like their depression wasn't as significant and it wasn't that big of a deal. And what that really truly is, y'all, that's just shame, right? You're just feeling ashamed and using this like idea that I'm not sick enough, right, is just, it's just a message to that shame, because when we feel something, our brain puts a narrative to it. Our brain likes to tell us a story. So although we can't always fix our feelings, because feelings just are like pooping, eating, we can change or rewrite the story that we tell ourselves. We can do a lot to change our thinking about things, and then that helps us manage our emotions, you know, to show up and care for ourselves in a different way. Oh my gosh, well, thank you. I'm glad I'm being helpful today. Yay. We do have to be told, you know, that symptoms are depression and anxiety, which is why mental health therapists, that's right, that's why we're here. But again, not everybody has the ability to be told that. So I'm trying to communicate the message. Listen, if you don't feel great, if you feel like there's a problem in your life, you're allowed to want to feel better about that. I'm all about self-improvement. So go improve yourself. Go and try to be your best self. Like, there's nothing wrong with that. I fully support you in wanting to feel and be and, you know, just live whatever best life is for you. Do I mind showing your meal? It's literally chips and a sandwich. Like I'm a middle schooler. Was the schooling hard because you want to be a trauma therapist or a therapist that specializes in eating disorders? You can do both. I specialize in trauma. In fact, my first love for the field was trauma. That's what I was going to do. I was like, eating disorders weren't on my radar. Then I had the opportunity to work with some eating disorder. Like, I worked at Timberline Knolls, and loved it. So yes, you can be both. Was the schooling hard? Parts of it were really hard. But I think when it's something that you care about and you have passion about, it's maybe not as hard. Like, you have to have time and the commitment, because you have to write 1 million papers and you have to, like, you know, there's testing and stuff, right? So you have to have, that's what's hard, is showing up to do those things and to try to do well in your program. But when you love it, it's not so hard to show up. That was my experience anyway. That's where you want to work? Is Timberline Knolls? Yes. My lunch is cute. Or the fact that I'm a middle schooler. I eat a middle school lunch. So I'm getting some questions on TikTok about my education. So, master's degree in forensic psychology with clinical or counseling, like, classes and the internship, the practicum piece, and got my master's degree. Worked at Timberline Knolls, became a licensed therapist, took that test, right? Did those hours. Worked for many years as a therapist in different agencies. And then I don't know, 6 years ago, started my private practice. And at that time, a colleague asked me, hey, what do you know about working with eating disorders? Because we have a need for that in our community. We're having to send everybody at least an hour plus away to get treatment. And I was like, well, you know, I've worked at Timberline Knolls. I have this experience. I love working with trauma. I have my PhD in health psychology. I also, so let me go and get my certified eating disorder specialist certification. So I went down that path, and as I learned about treating eating disorders and learned more about eating disorders, learned that I had orthorexia, and had the privilege, right? Really learning about eating disorders really helped me unfuck myself. And, you know, learning about intuitive eating and health at every size, and being able to see, like, eating disorders, how nuanced they are, and that they're not just what the DSM says, that they're a nuanced disease. And so I was able to learn the nuances of the disease and see how I had a really fucked up relationship with food in my body. So I walk the walk, or try to walk the walk, try to talk to whatever the saying is, and I try to, you know, if I'm telling you to do it, it's because not only does it work evidence-based, right, but also, like, I live it. So it works for me, it works for my clients, and then there's a whole bunch of research and science and, you know, theory to suggest that what I'm telling myself to do and what I'm telling my clients to do is legit. Which is why I also created the Recovery Academy, is because there aren't many specialists out there. There's a lot of therapists who say they treat eating disorders and they're doing really harmful things to people. So the Recovery Academy is a legit source. Like I was trained by the best. I was supervised by the best. I've worked with the best. Like, you know, so you're gonna get real evidence-based information at recovery-academy.com. Ooh, your therapist reminds you of me. Wait. I remind you of your therapist. Then you have a good therapist. I only have a few more minutes, y'all, because I have to get ready for what's next. But I'm going to spend a few more minutes because I still have some lunch to eat. Congratulations, Lauren Dickey 9A. Just started recovery. Proud of you. Yes, it can be harmful, right? Because I'm seeing on, I'm not getting anything on Facebook. I don't think I've seen enough. I don't think I've seen anything come through. Or YouTube. Yes, therapists can cause a great harm to your eating disorder, which is why I really think if you're somebody who is struggling with food and body stuff, try to find a specialist, right? Because there is a lot of stigmatizing that happens. I've seen people get put on, I've seen terrible advice, harmful advice happen when the therapist just thought they were coming from a good place. But it really is a nuanced disease, and it's not as simple as just restricting or binge eating. God, I wish it were. If it was that, Jesus. If it were as simple as restricting or binging, I would have all of my clients fixed in weeks, but it's not that simple. So JC2351, the trick is to have candy in your house, and I know that feels really scary, but when we can start, the saying goes, when we give ourselves permission to eat all the food on the table, we don't have to eat all the food on the table. It's this idea of like, yes, I can eat this candy. I can eat this candy when I want, and it's totally fine and totally okay. But it's all like, I can have this candy anytime. So it doesn't feel like this need that I have to eat and consume all of this candy, because you're telling yourself it's bad. You're telling yourself you can't have this. When you're like, I can have it whenever I want, it's kind of like, well, okay, like I can eat some now and I can eat some later. So I have someone here who says they think they're relapsing and they're scared. Well, thanks for saying something. I'm proud of you. Let me invite you to come check out recovery-academy.com and see if you can just get like some information to help you see that maybe, you know, what is your problem? And then how do you ask for help for your problem? How do you find the right person? If you're telling yourself you're not sick enough, that's a sick thought. Normal, healthy people don't think that. Hi. And definitely if you have a therapist and you think you're relapsing, tell them. Reach out to an old therapist. Okay, friends. I'm about to hang this up. so that I can finish my lunch and time. Sorry, I lost my train of thought. I was reading the comments. So that I can get ready for the next thing for my day. Yeah, matzo ball soup. Go for it. Do it. You're welcome. Thank y'all for being here. I'll be back next week. And for those who celebrate Easter or Passover, you know, enjoy the weekend. Celebrate how you like to celebrate. Eat whatever food that means, right? The peeps. Even if you don't celebrate Easter, still enjoy like the candy and the peeps because we don't get them all the time. All right. I will see you on Monday. Y'all are great. I'm proud of you. Keep kicking ass. Bye, y'all.